Let's talk about the two biggest problems facing private practice owners of physical therapy clinics in 2024. Number one is shortages in staffing. If we can't access highly motivated, highly qualified professionals, we can't deliver more care. And if we can't deliver more care, we're going to be limited or throttled in what we can do to grow our practice. On the flip side of that, declining reimbursement is another big challenge, and the two go hand in hand. We're getting paid less. Great clinicians want to be paid more. Schooling, cost of living, all of these things are getting more expensive. So how are private practice owners going to compete in that kind of environment, not just in 2024, but moving into the rest of the 2020th decade? I think a lot of it's going to come from cost savings that come from other places like artificial intelligence. And then it's going to come from finding alternative ways to monetize what we do. So historically, we've been able to rely on third-party payer reimbursement to pay for most physical therapy services that are medically necessary. And I can tell you, I heard the stories when I was first a private practice owner back in the mid-2000s that therapists 10, 15 years earlier were getting paid $300 and $400 to do a typical 10-minute hot pack, 10-minute e-stim, 10 minutes of exercise, 10 minutes of ice pack. It was ridiculous. Like, we were getting paid so much money for such poor intervention quality, but nobody was really doing anything about it at that time. And then when I stepped into private practice ownership, we were still getting 150 on average per session. We were doing pretty well, but then over the years, that reimbursement continues to decline. When I went through school back in 2005, I didn't have any student loans. Tuition was probably $5,000 a semester, give or take. And it was really easy to afford the PT education. Now in 2021, 22, 23, we're looking at students coming out with over $100,000 in debt. We're looking at cost of living going up, interest rates going up, inflation declining the value of a dollar. And so we need to figure out what are the alternative ways to monetize so that we're not solely dependent on patient care. And I think a third barrier to growth and challenge we face in 2024 is the practice owners' unwillingness to change what they've always done. Just because we've always billed insurance or just because we've always billed the patient doesn't mean that that's the best way to monetize the service we want to deliver moving into the future. Just because we've always relied on documentation being done by the clinician rather than leveraging the technology that we have in artificial intelligence, that doesn't mean that's the best way to do it in the future. And so any practice owner coming to me today or aspiring practice owner looking for advice, I typically tell them the same thing. If you want to get the same mediocre or poor performance out of a physical therapy clinic that therapists are getting right now, do what everybody else is doing. But if you want to get exceedingly positive outcomes for your patients and run a profitable business, you have to find a new way to operate because 2024 forward is not going to be the way it was in the early 2000s.